Good afternoon. Big news coming out of the FDA today that impacts some of our teenagers, especially when it comes to booster shots. The FDA is now expanding its eligibility for booster shots down to 16 and 17-year-olds. So 16 and 17-year-olds in the United States are now eligible for COVID booster shots per the FDA. The CDC still does have to give its final stamp of approval, but we're expecting that ruling to come down today. So one step closer for teenagers 16 and 17 years old to be able to get those booster shots. Now, this is specific to the Pfizer vaccine because the Pfizer vaccine is the only one that is eligible for teenagers right now in the United States. Here's the information that we have right now on WVLT.tv if you want to read a little bit more about it. But we'll go into some detail about what this means. This, of course, is the third dose of the Pfizer vaccine. So following the traditional 2-dose and then 6 months after the second shot, teenagers now 16 and 17 years old are eligible to get the booster shot. We've heard from the CDC, we've heard from the FDA, we've heard from health experts who have been studying COVID all throughout the pandemic who have encouraged people to get the vaccine and further encouraged people to get their booster shots. And now they're saying that includes 16 and 17-year-olds, of course, with the Pfizer vaccine. Vaccines just became eligible for a younger population. That 5 to 11-year-old age group is now eligible to get the Pfizer vaccine as well. No word yet on booster shots and what the FDA's recommendation is for children in that age group, for children who are younger than 16 years old. Of course, we'll expect more information to come out as more research is done for the lower than 16-year-old age group. And of course, we'll let you know if there is approval for children who are under 5 to get their initial doses of the vaccine. Concern mostly surrounding Pfizer and even Moderna for older teenagers has been the myocarditis, the heart inflammation. Experts, the more that they're seeing vaccines in younger people, are saying that's still a very, very rare side effect. And because if a child potentially is infected with COVID, then that also heart inflammation can also be a potential side effect. Again, rare, but it can also happen with COVID. So the experts are saying the benefits of the vaccine, the benefits now of the booster shot for children who are 16 years old and up, the benefits are now severely outweighing the risk of getting the vaccine. That's why the FDA is now encouraging children 16, 17, and then adults older than that all to get their booster vaccine. So that now needs approval from the CDC, but the U.S. is granting 16 and 17-year-olds eligibility to get the Pfizer vaccine. So that age group is now allowed to get their booster shot. Some more information about booster shots. Of course, adults are also encouraged to get their booster shots. 18 and up are also encouraged to continue to be vaccinated against COVID-19. And there is some more information coming out about that today. We'll take a listen.
In the fight against COVID-19, the FDA has authorized booster shots for almost 4 million 16 and 17-year-olds.
If you get the booster, you're really in good shape.
Adding teens could help lagging booster shot rates. Only 26% of eligible Americans have gotten the booster so far. Just over 24% of those who can get the vaccine haven't gotten a single dose.
With the new Omicron variant threatening, health experts say there's even greater urgency to take whatever steps possible to protect yourself.
Unless we really double down on what we're doing, we could see an increased spike that goes even higher than that as we get deeper into December and January.
Pfizer says its additional booster shot increases protection 25-fold against the new variant.
At first, we were skeptical about do we need it or not, but once we heard there was another variant out there, there's no taking chances.
For now, it is the Delta variant causing the most U.S. infections. 4 states are currently seeing record hospitalizations compared to any point during the pandemic. Bradley Blackburn, CBS News, New York.